The sternocleidomastoid is another really important muscle for a number of different reasons, and we'll talk about some of those during the technique video. What I'd like to emphasize here is we attach up here, having a common attachment to the mastoid process, but inferiorly off of the sternum and off of the clavicle. They each have their own areas of pain that they like to cause, and they're often injured during a whiplash type of an injury, making it a real common muscle to have problems with. Now, it is one of the least active motions in the head and neck area. It simply is not doing that much work. The other work is being done by other muscles. Your big postural clue to this is when the person has a head forward posture. You're going to probably want to take care of this. If there's a lack of rotation, that can also be an indication for this. The things that you're going to see, the diagnoses that come across your office here, you'll get an atypical facial neuralgia type of a complaint. Sinusitis types of issues are interesting. A unilateral deafness on one side oftentimes can respond to treatment here of the clavicular division. And then any type of ear pain can be very important. So let's go treat our sternocleidomastoid. The sternocleidomastoid has two different heads. Because of the two different heads, we're going to have two different treatment techniques, but they also cause different symptoms, which is important to know when we're doing the spray and stretch technique, because we need to know which head we need to spray. So for the first head here, we're going to look at the clavicular division. The lower fibers tend to cause pain over the manubrium and a dry smoker's cough. Middle fibers tend to cause pain in the cheek, the temple, and the vertex. That would be very common in a temporomandibular joint dysfunction. It can maintain that pain pattern. The uppermost fibers tend to cause pain sometimes in the ear, but generally the back of the head and the upper cervical region. So we're going to have we have actually two stretches to be able to do the sternal division. What we're going to do is anchor the hand, and then we're going to do a chin tuck and turn the head just a little to the same side. I'll be spraying over the muscle and through its pain pattern. And deep breath in for me, and exhale. So as we're coming around here, we're able to get a little bit of a turn into the head and down into the cheek. Again, deep breath in and exhale. And over the top and down into the cheek again. And deep breath in and exhale. And this time I'm going to come up over the top of the head for any vertex type pain. And we'll come back out of that and rewarm the area. And then I'd like to go ahead and show a secondary way of treating this, because it's nice to have more than one way to treat a muscle. So we're going to warm this up very briefly and then do a second treatment for that sternal division. A variation of that treatment is going to be to bring the head back into extension, side bending with a chin tuck, and the patient's able to feel a very nice pull right at the top here. Now, deep breath back in. And exhale. Again, right around the ear and into the cheek. And deep breath in again. And exhale. This time I'll come up over the temple. And one final one, deep breath in. And this time I'm going over the vertex. And bring the head back up. Okay. Now that we've taken care of that aspect of it, we still need to come back and rewarm, because it's incredibly important with this muscle, because we have different fibers. We need to stop between the two. I like to spray 3 times and then follow up with heat and then begin doing the second spray, which will be for the clavicular section. So the clavicular section is going to require a different angle, but its symptoms are different. The symptoms caused by the clavicular section tend to go into the ear. Sometimes the patient will report a unilateral deafness. The other thing that they tend to do is they cause some disequilibrium or underestimating the weight that you got in one hand. In order to stretch this, again, we anchor the hand. We're going to turn the head about 45 degrees and bring the back ear down towards the scapula, and I'll be spraying up over this area, right to the back of the head here. And also, it tends to refer pain across the forehead, so I'm going to ask my patient to cover his eyes So I can spray across the forehead, and not only does the pain go to the forehead, it crosses and goes to the other side. So let's spray that whole area. Deep breath in, sir, and exhale. So up through the pattern, and then we're going to come around the forehead. Again, deep breath in, and exhale. Again, through the muscle, around the pain pattern. And one more time, deep breath in, and exhale. Through the muscle, around the head, and into the forehead. And then I'll bring him back up. And again, we want to make sure to rewarm the area, so that it's important that we bring the heat all the way around the neck, but also around the forehead. So it looks kind of funny, but it works, and it's essential. If the person were to go into a cold area, walk outside during a snowstorm, or walk in through a grocery store through the frozen food section, and we hadn't warmed the forehead, we might create a headache in this area. Okay, in order to stretch the sternal division, what we're going to do is anchor the hand to the side, tuck the chin, and turn it just a little bit, and use this hand now to pull down and do it. Look back towards me just a bit. That puts a nice stretch. Now, deep breath in through the nose, now through the mouth. And again, as he's exhaling and taking up the slack, he's getting a very nice stretch through here. He can do this at work in a chair. He can do this while he's at home. Sometimes I've had people actually set up a stool in the shower where the water is hitting through the area, and they're able to do the same thing.